and we are a dental technology IT group based out of the Bel Air region, but servicing the Mid-Atlantic. Um, Today, we are going to be welcoming Jason West. Jason West is a local practice consultant, and he's going to share all the information that he has, or some information that he has, on how to sort of work in your business, or work on the business rather than in the business. Give us some great insight as to just the patient value, increasing patient value. Some few housekeeping items as we get going. We're going to go ahead and do the presentation, which will be about 30 minutes. After that, we will have a Q&A for 15 minutes or so. The webinar is being recorded, so you can listen to this webinar at any time at the DTC YouTube channel. So we'll go ahead and send out a follow-up with that link. You'll notice that you have an option to go ahead and raise your hand if you have a question. Feel free to go ahead and click that icon, type in any questions that you may have, and then at the end we'll be able to go ahead and hit them as they come through. Again, I'd like to just take time and thank Jason for joining us. He is a very highly thought of practice consultant. We are really lucky to have him just donating his time for us, and I'm sure everyone's going to see value out of that. And then Jason, I'll just let you take it away.
Great. Well, thank you, Darren, for that introduction, and thank you to DTC and Casey for inviting me to speak today. I'm very honored to do so, and I've been looking forward to this for quite some time now. So thank you again to you guys. First, I'd just like to start off with just talking a little bit about myself. So I've been in the dental industry since around 2012. Started out in kind of dental insurance, which is a hot topic right now, and then moved my way to the good side of dentistry onto the practice care side. So there's a picture of myself and my wife and daughter. We actually have a little dental family because my wife is a dental assistant and has been one for quite some time now, and just recently we had our daughter in July 2015. So just taking some time off to be a mom, and very lucky to be able to do that. I always like to start out a presentation with a quote that I find impactful and is important to me. So Charles Darwin said in 1809, it is not the strongest of the species that survives, nor the most intelligent, but the one most responsive to change. So change is the only consistent thing we experience in our lives. So we must accept that fact and adapt with change. And it's important in the dental industry. So just want to go over a few trends that I see in the dental marketplace. Right now it's a crowded marketplace. There are nearly 200,000 dentists practicing in approximately 165,000 dental practices in the U.S. 17% of dentists now work in group or corporate practice settings. PPOs are dominating the insurance landscape. By the end of 2016, it was projected that 90% of all dental insurance plans sold will be PPOs. Today's patients belong to the PPO, not the doctor, which is unfortunate. Dental spending is flat. The ADA projects dental spending will be flat for the next 10 years. The industry is changing faster than ever before. Consumers are less patient. They want their needs met now. Patients are more price conscious and have more access to information than they ever had before with the introduction of the internet. They are looking for more value, and they are looking to their doctors, their dentists, to provide that value. A couple macro trends influencing dentistry. Local economies and employers continue to have a major impact on the dental industry. Employers offer their employees dental insurance. Dental insurance lately has been dictating the care given to the patient and not the doctor. So that's a huge problem right now. Patient spending grew 4% annually from 1990 to 2005. It's declined from 2008 to 2011. And as I said earlier, it's projected to remain flat for the next 10 years. Cost being too much. Despite being more affordable in recent years, cost is still cited as the #1 reason to skip dental care. Baby boomers have the highest dental expenditures and the most frequent visits. Young adults do not prioritize dental health care due to cost, time, and are less likely to have dental disease. The corporate dentistry, DSOs, large group practices, more prevalent than ever right now. Corporate dentistry is well funded and effectively managed. We see the Aspens and the Heartlands of the world. It has attractive compensation and work-life balance for dental professionals. It's comfortable, convenient, has reduced costs, and provides a retail-like experience for patients. Corporate dentistry has flexible, convenient hours for both patients and employees. Shared costs in personnel, rent, utilities, equipment, marketing. They have state-of-the-art facilities in prime locations with ample parking because they can afford to do these things. They have buying power and they can leverage insurance. PPOs still have a great effect on profitability. And as we can probably tell, it's only getting worse. The ADA states that the average national overhead for a practice is 70% of their production. So how does this affect you? Let's look at an example. So if we were not to take insurance and we received $1 million in production last year, and the ADA states that the average national overhead for practice is 70% of that production, the practice generated $300,000 in profit. Now, if we were to accept PPO insurance, if we were to go in network, most of the time we go in network because there's a decreased fee that is offered to the patients. And it's a marketing way for us to gain new patients. So by going in network, we reduce our fees. Let's say on average 15%. So that 15%, it's not decreasing the overhead, the profit that the practice makes. It's right off of the production. So you take 15% off $1 million worth of production, you're now at $850,000. Your overhead remains the same because your overhead is 70% of production. So overhead still being $700,000. So we look at the difference, we're now at a profit of $150,000. So just with a 15% write-off, we have now cut our profits by half. So that's a huge, huge deal going on in dentistry right now. So how does this affect you? We need to change. We must continue to change. Business as usual mindset is not a sustainable strategy for survival. So I put up a few pictures there because we all remember what Blockbuster was like, and now it's non-existent. Kodak began digital photography a long time ago, but thought there's always going to be a need for film, and have since fallen off. We never see payphones anymore. So we must continue to change, or else we are going to fall into the same trap that these companies fell into. I like to do a self-assessment. I think it's important to do a self-assessment when we think about how we're going to change. And it's certainly how we're going to keep up with the trends in dentistry. So self-assessment being, what is the patient experience like in your practice? Would your practice survive if corporate dentistry opened right next door to you? And I've seen it before. I've seen Aspens open up across the street from doctors. What's your brand? Is it clearly defined? Are you sending a definite message to the patient as to why they should be coming to you? And then other than your own perceptions, what do you think other people think about your practice? What do you think your peers think about your practice? So I think it's important to kind of take a step back and just assess your current situation, and especially right now at this time of year. Patient value. This leads into patient value. With all the trends and corporate dentistry coming in and PPOs and dentistry being flat, how are doctors still succeeding in this business? Because it's still a fantastic business, and it's through patient value. It's setting up the patient to exceed their expectations. Jeff Bezos is the owner of Amazon, and he said, "We see our customers as invited guests to a party, and we are the hosts. It's our job every day to make every important aspect of the customer experience a little bit better." But what does the value of a patient mean to us? We want to focus on our forever patients. First, our one-time patients. First of all, it's more fulfilling and more profitable. Seeing a huge number of people for a one-time, quick appointment is less fulfilling. What suffers with seeing a patient only once? The relationship, the comprehensive care provided to the patient, the longevity of the relationship, and of course, patient referrals. We should calculate, or at least try to calculate, the specific value of a new patient. Now, this is a hard calculation to come up with because there is no generic way to calculate the value of a new patient. Each practice being unique, but there's a good beginning guideline to calculate the average amount of dentistry diagnosed and received by your new patients. You should just start from scratch. Keep track of what you're doing for new patients. Continue to do this over time and gather data, and you will see how much a new patient is worth. Now, that's just for new patients. Now, let's look at our existing patients. Let's determine the lifetime value of an existing patient. So I put down a little formula here. The annual value or investment the patient makes in the practice added to the number of years, the referral number of years plus the referral value equals the customer lifetime value. So this is an important number because, you know, to understand how much a customer or patient is spending in the practice helps us to realize that we need to make sure we have a good patient recall system put into place, and that we are keeping our patients in our practice and not referring them out. We want to double from within by nurturing our existing patients. The bottom line is that most practices can double from within their own patient family. How do they do this? They can educate those patients who are already in the practice, who may need further treatment, or could be a referral source if nurtured and or asked. Also, too, to do a better job in the area of case presentation, including a better job of presenting the financial options. And then 3, we want to stay current with equipment and technology. We need to educate the patient to motivate them to take better care of their oral health. The ADA states that the average treatment plan is $1,500. If we could increase case acceptance by 1 per day, it would add up to $360,000 on an annual basis. So that's a huge jump. That's just 1 case a day. The 2 main reasons that people say no to recommended dental treatment are cost and no perceived need. We need to counter these objections during our case presentation, first clinically and then financially. So the ADA says that the average practice has a 61% case acceptance rate. We need to put into place an effective patient education system first by maximizing the use of visual aids and maximizing supportive educational resources. I personally believe the best way to do this is with a hygienist, because patients have a very special relationship with their hygienist. They see them more regularly than the doctor, and generally, typically talk more. And we all look at relationships and want to build great relationships. So we need to make sure the hygienist has enough time to not only treat the patient, but also educate and present the recommended treatment to the patient. So I think that this is important, because if we just look at blocking out a certain amount of time for the hygienist to perform the treatment, let's give that hygienist an extra 10, 15 minutes to really go through and show previous pictures of treatment acceptance or cases that we've presented to the patient. Really explain the effects of how your oral health is linked to your total health. So if we can do that, we might have one less hygiene visit per day, but if we can gain one more case acceptance, I mean, that's from what the ADA says, an average of $1,500. So I think that is thinking bigger picture and not so much get them in and get them out. Equipment and technology. It's always important to have the latest and greatest, and that's kind of what patients want. The changes in dental equipment and technology are improving yearly, daily. We're making it more convenient for the patient and more comfortable for the patient. Not only do we have convenience and efficiency in mind, it's helping the doctors diagnose more dentistry and better dentistry for the patient. So we look at that level of care that we provide, the patient value. You know, not only being able to talk about oral health, but total health and how it's all connected. And then, of course, the digital workflow. This comes into play when we think about how we can practice more efficiently. How does corporate dentistry do it? Because they have all of the equipment and technology. It is a fluid moving system within every single practice, and they put in the systems in place to make it that fluid movement. So the digital workflow is extremely important. So at this point, I like to do another self-assessment. We looked at the trends in dentistry. We looked at how we can bring more value to the patient, and which in turn will help our businesses grow. So where are we now? Where do we want to go? How do we want to get there? Right now is an incredible time to look at ourselves and give this self-assessment. Beginning of the year, we need to be setting goals for 2017. At the end of the year or the beginning of the year, strategic planning is beneficial. We want to evaluate the past year and set new goals. Focus on progress, development, and success. Benchmarking is a measurement of the quality of an organization's policies, products, programs, strategies, their comparison with standard measurements or similar measurements of its peers. The objectives of benchmarking are: 1, to determine what and where improvements are called for. 2, to analyze how other organizations achieve their high performance level. And 3, to use this information to improve performance. Some key steps of the benchmarking process. First, we want to analyze the present situation. What systems are working well for us? What could be improved? Where were our challenges last year? 2, study the systems of successful businesses. What have they done to accomplish their success? I think reading about not just dental business, but business in general, business books, getting the entrepreneurial magazine, things like that I feel are important, because now, when we own our own practice, we are businessmen first and clinicians second. And it's time we start to realize that we have to run a business, and it's tough, and there's a lot of moving parts out there. 3, compare your own data to other similar businesses. What do you like about other organizations? What would you like to achieve? Talk to your peers. Talk to other people that come into your practice who might be selling you stuff, who are, talk to DTC. See what other businesses and dentists are doing in the industry, and take a look at them and see what's made them successful. And then 4, determine the key areas you want to develop. Determine your benchmarks, your goals. Come up with a plan of action. Define who will do what, and then determine the time frames. Do what you say you will do. Implement your plan. Evaluate progress continuously. So just some key important figures and numbers to include in your own benchmarking process. You want to look at production, daily, monthly, yearly. Okay, a lot of practice management programs can show you what your production is on a daily basis and come up with daily huddles and things of that nature. So I think production is extremely important in having a better understanding of what the numbers are saying and what the numbers are doing in your practice. Next, obviously, is collection and collection percentage. How are we getting paid? When are we getting paid? What kind of adjustments we're making? Write-offs, things like that. How much are you writing off for being in network with your insurance providers? What has the biggest write-off? Which insurance provider has the biggest one for you? You know, where do most of your patients come from that has the biggest insurance write-off? So those are things that you may not think about in the beginning, but certainly have a huge impact on your collection. Individual provider production. So we need to look at what hygiene is doing, what the doctors are doing, just so we have a better understanding of our own practice. And then accounts receivable. How well is our front desk, our front staff able to track down patients with overdue balances, things like that. We don't ever want our aging report to be longer, 30, 60 days. Your new patients. I feel like most dentists know their new patients and can talk about it, on a monthly basis. So that's, but certainly an important number to think of. Just to go back to new patients, what I said earlier about nurturing from within. Okay, so I think we maximize our current patient set. And then once we have that down to a science, that's when we want the new patients to come in, because that's when we get growth. So like I said before, I think nurturing from within is better than just always going after the new patients. But it's always kind of important to have a good referral base and get new patients as well. Amount of cases presented and amount accepted. All right, so now we can kind of look at how we're doing. And take a step back and really kind of judge ourselves on what's working and what's not working. Is Susie the best one to lay out a treatment plan for our patients? Or is the hygienist better, or the office manager? This is kind of a sales role inside the practice, because it's being able to get the patient to first accept for the clinical reasons and then understand the financial reasons, right? So there's kind of a finesse and science behind it. And then we have marketing projects, amount invested, amount increased. So another huge thing that I see a lot of doctors do is they purchase a website and then they do zero marketing outside of that. Now, your number one marketing advantage is always going to be on a referral basis. It's your patient referral, so it's in-house, it's internal marketing. So that's always going to be the bread and butter. But you should still be spending on an annual basis 4 to 5% of your collection on some type of marketing trend, right? Because like I said earlier, patients and consumers want answers immediately, so they are going to the internet and websites and social media and things of that nature to get information about you. And if it's so easily accessible that if it's not attained immediately, then they're off to the next website. So it's important to have a marketing budget put in place. Absolutely. The next is performance goals of individual team members. So now's a perfect time to sit down with your team. Sit down with them and go over last year. Talk about things that they can improve on. Talk about CE, what they can be learning new in dentistry. I also like to ask them, what are their goals? What are their career goals? What do they want to do? What do they see themselves in 10 years? And how does the practice fit into that? So that's important for the doctor to realize, how are we going to keep good employees over the lifespan of the practice? Because employee turnover is huge, and it's a huge cost to the practice. So, when we find the right employees, we want to make sure that they stick around. And then we want to look at profit and loss versus overhead. Right. So like I said, the ADA says 70%. So we want to make sure we have a better understanding of profit and loss. Okay. Overhead is, for the most part, a lot of the fixed costs when it comes to things. So we can never save our way to prosperity for the most part. We need to look at ways to increase the business, increase the profit. That's the only way we're going to get to the next step, to our next goal, and to where we have initially seen ourselves going in dentistry. Next steps. Okay, so what should we be doing? Keep learning and adapting to the forever changing dental marketplace. Right? Those CE credits, reading books, asking your peers, asking other people in the industry. Like I said, we have to keep learning and changing. We can never stay stagnant. Understanding patient value. Patient value equals lifelong customer. That's what we want. That's the business model. Unless we're a specialty practice, the business model for GP should be to retain that patient for the life of that patient. Cradle to the grave. That's what we want. Next is understand how your practice operates and where improvements can be made. Have to have a blueprint of our practice. If we don't know the data behind our practice, then we're stagnant. We're not improving. We have no idea of where we're headed. We have to have a clear goal and process in mind. But first, we need to understand what is happening in our practice. And then I also think it's important, after we understand our practice, come up with your practice goals and revisit them each and every single month. At the beginning of the year, it's easy for us all to have New Year's resolutions and set goals. But then March comes around and we start to kind of slip a little bit. Make one of your goals to try and follow your goals for the whole year. Write your goals down. You are more likely to achieve your goals if you have them written down and have a better understanding of what you're trying to do. All in all, dentistry is still a fantastic business. You wouldn't have Wall Street and corporate dentistry coming into dentistry if it wasn't a fantastic business. So I think everyone is set up to succeed, and few are set up for failure. So we can do a lot of great things, but it's patient values, it's understanding the business, and it's moving forward with that mentality instead of the clinician's mind frame. So that's basically my presentation. Are there any questions?
So, Jason, yeah, thank you very much for the presentation. Great information. Real quick, sort of every time I hear these seminars, there's so many webinars that we participate in and meetings that we go to, and every time we hear the message of adapting to change, that always is such a huge point, and you can really see the ones that do and the ones that don't. And then the other thing that I really got out of that, Jason, was the statistics, making sure you know what the data says about the practice, and that really does help drive goals. We are fortunate enough to work with a lot of different companies, and we've seen mom and pop shops really focus on letting the data analytics drive the way the business grows, and there's been a lot of success there. So it is certainly true no matter what level business, what size business, or what type of business that you're in, that the statistics generating the goals and then having those written goals is definitely key. So as far as questions that I see coming in, I have a couple that have come in, Jason, so I'll just go in order right now, the ones that we
Sure,
have.
yeah, great.
So the first one I see is, what do you think, how do you overcome objections from a patient when presenting treatment options? And I'll tell you right now, I am the classic case of this. So I'm always first to refuse. But what would you say to that sort of situation?
Yeah, so that is one of the most important questions because you see that on every probably case presentation, right? It's overcoming those objections. Those patients that we've kind of groomed into saying, yeah, sure, you know what, whatever you suggest, are amazing, and we'd love to have every patient like that, but sometimes it's few and far between. Um, so there's always going to be objections. And the first thing you want to do is you want to hear out the objection, right? Let them finish. Too many times we just quickly try and cut them off and come up with a solution. So I think it's important to take a step back and listen. Let the person tell you everything. Actively listen to what they are explaining and what they are objecting. Um, Next is reinforcing the importance of the objection. Okay, so there's no benefit to disagreeing with or arguing with the patient. We don't want to do that. When you listen to their concerns, express an understanding of those concerns. Empathize, but don't sympathize. So, for example, Ms. Jones, I can appreciate your surprise. That's why we have many excellent financial options for our patients. We want to provide excellent clinical service and excellent financial service to you. Not, yes, Mrs. Jones, that is a lot of money. I'd be overwhelmed too. So you want to kind of put a nice little spin on it. You also want to answer the objection. Provide further education. So that's why I touched on patient education. Being able to use visual aids, showing the patient. Yes, I understand, that the tooth may not hurt now, but Mrs. Jones, you see in this picture that we just took, you have your tooth is fractured. This is only going to create more dentistry for yourself down the road and be, not as beneficial to your health. So there's ways that we have to answer the objection. Provide better health, last longer, look better, and ultimately and save money in the long run. And then finally, we want to offer a solution to the problem. So, for example, patient says, I don't know about this. I'm not sure if I can afford this. Is there any way I can pay for this out for a while? Well, sure. Yeah, we do have several financial options available. I'm sure one will work for you. We do have options that will let you stretch out your payments. How much would you be comfortable for you to pay per month? So it's having solutions. It's being able to counter those objections because the first one is always cost, and then it's clinically, or maybe it's even pain too. So that can come into play with having the right equipment in place to cause less pain to the patient, make the patient more comfortable. So I'm a big fan of having scripts in the office, all right, and kind of understanding how to answer objections and answering it the same way each time. So our staff gets amazing at it. Okay, but we want to be positive and less negative, and I feel like too many times we're negative. And then finally, we want to close. Right? We want to close on the patient. Once you've dealt with the objections, ask for a commitment. Closing an agreement means asking. So, Mrs. Jones, is there anything else that would keep us from going ahead with your treatment, or are you ready to schedule that first appointment? We got to close. We got to ask. And it's the same with patient referrals, too. We just got to ask. How many times are we asking our patients? In summary, it's hear out the objection, actively listen, reinforce the importance of the objection, offer a solution to the problem, check to see if the solution will work for the patient, change the direction of the conversation, move forward, and then close.
All right. I think that is a definite great strategy to put in place. Um, Next question I've got here for you, Jason, is what is the greatest challenge for understanding the business side of dentistry? How can they essentially improve in understanding the business side?
Well, I think the answer to that question is first understanding that we need to understand the business side. So that is, you know, crucial. Understanding that there are a ton of different moving parts when owning your own business, and uh, it's a lot, and it's very involved. And most dentists do not go through any business training when they're in school. So it's unfortunate that the dental school doesn't provide more additional training when it comes to owning your own business. So I think understanding that that a doctor needs to learn more about the business is the first. I think that is amazing. Next, it's first. I think overall, it's understanding what your practice is doing. Okay, taking a step back and seeing what kind of demographics come to your practice, what kind of dentistry you're doing, how much you're making, how much you're writing off, understanding the patient age base, where they're coming from, what employers your patients are working for, because employers obviously correlates with the insurance that you're accepting. Okay, so a lot of times we might have Under Armour down the street, and we're seeing all of Under Armour's employees. So I think it's important to understand the metrics and the data that's within our practice first, and then it's important to get that information and then move to the next step. And it's kind of dividing a plan of action. And that's certainly something that I could help out with any doctor that was interested in coming up with a plan of action. But like I said, Darren, I think it ultimately boils down to understanding what you're doing first and foremost, and then creating a plan of what you want to do and where you want to go with your business.
Absolutely, absolutely. Um, all right, I don't see any other questions here. So, sort of wrap up here. The point of these webinars is to make sure that we're able to get information out to the dental community. There's a lot of questions and concerns about how to run the business, how to effectively build the business, how to treat patients, all types of questions out there. So we're hoping that these webinars are providing value to our client base and anybody else who's joining in. That is only made possible with the volunteering of the time by people like Jason. So again, Jason, I want to take time and again thank you for contributing. I see your contact information is up there. Is it okay if anybody contacts you via the cell phone number or that number and then your email address? That
Absolutely, yes. Please reach out to me. I'm available basically 24/7. My daughter doesn't sleep all that well, so call me, reach out to me anytime with any questions. I'm extremely passionate about the business of dentistry, so I love every aspect about it. So please reach out to me. Let me know if I can help anybody moving forward.
Great. And then our next webinar that we have coming up, again, these are the second Thursday of every month at 1 o'clock. The next webinar that we have coming up is going to be basically, we're going to have welcome back Arminco and Bank of America again, in maximizing your space. So there are lots of different ways that we can use the space in a dental practice. And what Arminco and Bank of America is going to do is going to show us how to use some of those rooms in a more efficient and profitable manner. So continue to look for those email blasts coming out. Again, this webinar will be available on our YouTube channel. If you have any questions or concerns or you want to talk to Jason, feel free to reach out to us. And we'd love to be able to continue to help you build the practice. And thank you again for joining us, and we will see you next month, second Thursday at 1 o'clock for Maximizing Your Space with Bank of America and Arminco. Take care, everybody, and have a great week.
Thank you.